Health officials say a person tested positive in Wake County. Governor Cooper says the state lab has been testing for the coronavirus and today confirmed the first presumptive positive result.
Now, he said presumptive because the CDC still has to confirm the case. Now, we know that person is in the Raleigh area, Wake County to be exact. Now, they traveled to a long-term care center in Washington state, and that has really been the focal point of the coronavirus right here in the U.S., almost ground zero here in the U.S. All 9 deaths from the virus have happened in Washington. Most of them are linked to that center.
Worldwide, there are more than 90,000 cases and more than 3,100 deaths from the virus. The TSA is directing airlines at 280 airports around the world to ask U.S.-bound passengers about recent travel to China and Iran. The hope is they prevent people from coming to the U.S. and further spreading the virus.
Well, so many of us are just wondering, especially with that case in North Carolina, what can we do to stay safe?
In the last 45 minutes, I spoke with UNC Charlotte professor Daniel Janis about what this means. Dr. Daniel Janis, thank you for being with us tonight. You study the makeup and the evolution of these viruses. Are you surprised that we're now seeing the first case of coronavirus in North Carolina?
Not really, because we saw cases in the West Coast, specifically Seattle, associated with people who had not traveled and had not been able to be traced back to travelers. So it's just a matter of time before it started to pop up everywhere.
What is it about this virus that makes it particularly easy to spread? You were saying that what's kind of unique is in that incubation period, people may not really be symptomatic.
Yeah, it's pretty clear that the virus keeps you walking around and you can spread it to others before you elicit a lot of symptoms, and that's why it's so good at moving around the world.
You study the inside of the virus. What do you think we're in store for here in the United States and here in North Carolina?
Well, we're in store for a lot of cases. If you know, the other nations that have experienced it, Italy, Korea, China are any examples, we're in store for a lot of cases. So.
And to a lot of people that may sound really alarming. Should we be alarmed?
If you're healthy, it's probably no more than a cold or a flu. However, if you have underlying respiratory illnesses, you should get special treatment.
There's a lot of talk of how this is similar in terms of symptoms to a flu virus, and the precautions are very similar in terms of general hygiene, washing hands, things like that. Is that the best way, from your research side of things, for us to protect ourselves?
Yes, of course. For all medical advice, follow your physician's advice and the advice of the CDC. Hand hygiene is really important. Not going to big public gatherings is really important, and so forth.
There is no vaccine against the coronavirus, and it could be a while before we get there?
Correct. Anthony Fauci's the head of the NIAID, and he's warning about a year.
So in the meantime, what's your recommendation for people who may be hearing coronavirus and really concerned?
Well, all those basic pieces of advice: wash your hands, stay away from large public gatherings. If you are sick, please stay home so you don't infect your coworkers and classmates.
And your work, where does it go from here in studying coronavirus?
Well, we're working on the evolution of this virus and its relationships to other coronaviruses. This is actually the 5th time coronaviruses in recent memory have invaded the human population. So this is not new at all.
New to a lot of us,
yeah.
Maybe not to you. But we thank you for your expertise and for bringing some insight into this virus and what we should be aware of.
Okay.
Thank you very much.
Thanks for having me.
Mm-hmm.